So I heard you wanted to talk about options for birth control, right?
Yeah, so my fiance and I were getting married in a couple of months, but we wanted to wait until graduation to start a family. So I just wanted to look at options. I heard that there are like some health risks and everything involved. So I was just wondering what the options are.
So I can walk you through some of the options available
Okay.
for contraception. The most commonly used is oral contraception. So these adjust your hormones and they prevent you from developing a pregnancy by just using the way your body works and just keeping the place where it can't have a pregnancy. Um, you take them once a day, and yeah,
Okay.
they're
What?
also they're also non-invasive. So that's a
Yeah, that's true. That's a plus. What are like the health risks associated with it? I've heard that like blood clots can be an issue.
blood clots can happen, but there's very low chances. And if you're really worried about that, then you can use ones that only have progesterone rather than a mix of hormones, and those will reduce the risk of blood clots even further.
Okay, cool. Because yeah, my family has a history of blood clots, so I was just a little worried about that. What are some of the other options? I know a lot of women go with like an IUD.
Okay, so an IUD, you have two variations. You have a copper and you have a hormonal. The copper one just messes up the sperm; it doesn't work properly,
Okay.
and they're a good long term option, especially if you don't want to do hormonal. Then the copper is be a good idea.
Okay. Okay, that makes sense. I do have a little concern with that. Sometimes my skin gets irritated with different things. So would the copper cause that irritation?
It can, but usually it doesn't. I mean, if you're really worried about that, we can also test it and see if you're sensitive to having copper on your skin. We can figure that out.
Okay. Okay, sounds good. Were there any other options that I can look through?
So usually the other options aside from like the hormonal things is you can either have it's just a physical barrier, something that stops the sperm, the semen from getting too far, or for when it gets there, it just um, kills the sperm.
Okay.
So, and you got to make sure if you are going to use that, you do want to make sure you're using it correctly. So you got to just read the instructions,
For
and
sure.
then yeah, you'll have that right.
Okay. Okay, that makes sense. I think that's all the questions I have for now, so I'll just think it through and then get back with you guys.
All right,
Thank
thanks.
you.